Hello and welcome back to GP Video Podcast by Nadia. So today the topic that I'm going to talk to you about is called globus pharyngeus. I'm not sure how many of you have heard about it, but since I've started practicing in general practice world, I also wasn't aware about it like when I was in the hospital then. But as I said that since I've started working as a general practitioner, I've had a few presentations to me with people complaining about a lump in the throat. So, feeling of a sensation of a lump in the throat, especially when they are swallowing food or trying to swallow saliva, there is a constant feeling of a lump in the throat, which they can't really describe, but they think there is something stuck there. So when I tried reading about it, of course, after excluding, so we did like all kinds of tests. We did blood tests to see whether there is thyroid, then physical examination to see whether there is a lymph node there or thyroid there or anything that could be of importance. And then, of course, looking inside the throat and doing scopes and all, barium swallow and all those kind of investigations to exclude all the physical causes, especially because people are mostly concerned about, pharyngeal or laryngeal cancers, that there is a lump there. So after excluding everything, the condition that is most probably the cause is called globus pharyngeus. Now, what is globus pharyngeus? I am going to read this article with you and share my knowledge with you. So globus then, because now when I'm talking about it, I can also feel like there's a lump in my throat. Alrighty. Globus sensation is the feeling of having a lump in the throat when in fact there is nothing there. The sensation can come and go and does not interfere with eating and drinking. So you can feel that there is a lump, but then that lump does not interfere. So there is no problem in swallowing, but while swallowing, you feel that there is a lump there. The exact cause of globus sensation is uncertain. Examination and investigations may be carried out to exclude any other underlying problem. Reassurance that there is no serious underlying problem may be all that is needed in terms of treatment. So globus sensation is the term when a patient has the feeling of a lump in the back of their throat when actually there is no abnormality present when the throat is examined. Globus sensation is sometimes called globus pharyngeus. Pharynx refers to the throat in medical terms. It used to be called globus hystericus, which is a term no longer used. So globus pharyngeus, globus sensation, or globus hystericus, they are all the same. So as I think, explained this in a lot of my video podcasts, that what structures do we have and how does the digestive system start and where does it end? So of course, whenever you eat something, it goes into your mouth. Down the mouth is the pipe called pharynx. And then from pharynx, it goes in the chest in the part called esophagus. Then from esophagus, it goes into the stomach. From stomach into small intestine, then large intestine, then rectum, anus, and out. Now, in the throat, in front, what we have is called larynx. Larynx, what is larynx? Larynx is part of the respiratory tract. So it is the windpipe. Behind the windpipe is the throat, which is called the pharynx, which is the part of the digestive tract. So basically, it is called globus pharyngeus because, of course, when there is a lump that you can feel, and that lump, though it does not interfere with your eating or drinking, but while you're eating or drinking, you can feel that there is a lump there, or you can feel this sensation even without eating and drinking. So while you are, trying to swallow your saliva, or just a feeling of unease that there is a lump there. So what causes globus sensation? The exact cause of globus sensation is basically not known. Some specialists believe that it is due to a problem with the coordination of the muscles involved in swallowing. Many muscles are involved in swallowing and they need to tense and relax in the correct sequence for swallowing to occur normally. In someone with globus sensation, when they try to swallow saliva, some of the swallowing muscles may not relax fully, and so the sensation of a lump in the throat occurs. However, when food is swallowed, the food stimulates the muscle in a different way and normal muscle relaxation occurs. It is thought that reflux of acid from the stomach into the esophagus may also contribute to the cause of Globus sensation in some cases. So acid reflux. Acid reflux can be one of the causes of Globus sensation. The theory is that the stomach acid affects the relaxation of the muscles around the throat. In many people, stress or anxiety can trigger Globus sensation or make the symptoms worse. Tiredness can also make the feeling more noticeable. Having an excess of mucus running from the nose down into the back of the throat, known as post-nasal drip, may also make the symptoms of Globus sensation worse. So now, what did we get? What could be the causes? Number one could be acid reflux. Number two could be stress or anxiety. And number three could be post-nasal drip. So all these either cause or aggravate the symptoms of this Globus sensation that is present in the throat while trying to swallow saliva or while trying to swallow food. Sometimes, though, they say that food usually affects the muscles of swallowing, like, nicely, and they are, contracted and relaxed in the normal sequence. But saliva swallowing can sometimes not trigger the muscles of swallowing to contract and release in a good sequential manner. So sometimes swallowing saliva causes this sensation more prominent than the swallowing of food. So and then, as I said, that this sensation should not cause difficulty in swallowing. This should just only cause you to have the sensation of that lump in your throat. That's all. So that is called globus pharyngeus. So the theory is that the muscles of swallowing do not relax and contract in a proper sequential manner. That's why you get this, lump feeling. And the factors that cause it are, or exaggerate it, are acid reflux, anxiety and stress, and also what was the third one? The third one was having an excess of mucus. So post-nasal drip. So post-nasal drip going into your throat or pharynx can also cause this. We will talk more about it and what is the treatment and what are the investigations we should carry out to exclude all the other causes, including cancer, throat cancer. I will talk to you about it tomorrow.